You are in the Issue Station Southwest Missouri panel. If you didn't mean to be here, you want to go next door. So I want to thank everyone for coming today. And so what we wanted to do was, we're offering training to help everyone who wants to volunteer and get out and talk to potential voters. Because the reason people get out and get involved and vote is they care about what's happening in our communities. If we don't know what's happening in our communities, then how can we talk to people about it? And we want to have one solidified message. So we brought in a panel of experts to talk to us about what's happening so that we can then go out in the community and share that message. I want to make sure that everyone knows that today's panel is being recorded, so behave yourselves because we have proof that this is happening. Everyone is going to have 5 minutes to speak. Jack, 5 minutes.
You want me to start now?
Just a second.
I got one of those little buttons that says I don't want to be photographed. I usually wear that. Now, those of you...
Your 5 minutes hasn't started yet.
I yield my time.
How many people here know about that?
Okay.
You can put a little button on
Jack.
that says I don't want to be photographed.
Everyone's going to have 5 minutes, and then at the end, the floor will be opened up for questions. I'm going to do my very best to get us have a lunch to go to, and I've already been warned so that people are going to start going out of here quickly because people have places to go and people to see. So on that note, we'll start with the panelists and then we'll have some questions. We're going to start right here. This wonderful young man got voluntold to be here. He is representing the Springfield Police Department, and he is going to be sharing information with us about crime and drugs in Southwest Missouri and Springfield.
How you doing? I'm Jim Greene. I'm a police officer for the city of Springfield. I've been here. I'm in my 6th year now. I was down in South Florida for about 5.5, 6 years in a much more diverse community of Southeast Florida. I'm currently on our community services section. I'm a PAR officer, police area representative for the northeast side of the city. I don't know if most everybody's local in here. The north side of the city is generally referred to as a little rougher, a little more crime, a little lower income of an area. So right now there's about 6 of us total for the city. We try to do long-term investigations or long-term community problems. So anything from my neighbor's maybe a drug dealer to my neighbor cut down their tree and it landed on my car and he won't pay to fix it and now we're fighting. So it's as little as that to as extensive as a drug thing. I gotta say 95% of my complaints-ish are drug-related, have something to do with drugs. So I mean, it's huge. Our commanders, I'm just an officer, lowly officer on the totem pole here, but our commanders will try to tell our unit, you're not a drug unit. You're not a drug unit. We do have drug units. We have a special investigations unit. They can only do so much, and they try to focus on the bigger picture. So once we check with them, when we get a complaint, I mean, we still have to do it, even though our commanders are saying we're not a drug unit. We can't just tell these neighbors that. So I kind of wish they would get out of that stipulation of telling us that, because I don't think of myself as some drug cop, but I think of myself as trying to better the community and the neighborhoods I work in, and almost all of that has something to do with drugs. It may be stolen property, but people are stealing this stuff because they're using drugs. You know, it may be stolen cars, all kinds of property crimes. There's so many going on in Springfield. Property crimes are real big right now, and everyone I deal with or arrest, I either know is a drug user, kind of try to get clean, or couldn't stay clean and back on it, and that's all they know to do. The forgeries, the counterfeiting, you get your card stolen, you get your car broken into, then there's like 9 other crimes that happen after that, and they're all drug related. They're trying to get money. They trade gift cards for drugs. They trade stolen merchandise for drugs. They pawn your stuff to go get drug money. I mean, it's pretty much everywhere, and there are the south side of the city too. A lot of the north side neighborhoods I work in, you know, they sometimes feel that they are targeted more, but because people just have this negative connotation in the north side of town. But I try to tell them, I mean, there's drugs all over the south side. There might be more drugs just because they hide it a little better on the south side. So we try to combat it. There's only 6 of us, of course, but you know, we have about, right now we're fully staffed police-wise. We have the majority of our police answer 911 calls, and that is anything from domestic violence to just check well-beings to potential drug stuff, where we had 2 shootings last night, early morning hours. So Springfield's kind of, it's not the small, sleepy city anymore. It's the 3rd biggest city in Missouri, and it seems to be this gateway for a lot of people that I almost joke about these, because they ask if we have a gang problem here. We don't really have set gangs. We have kind of like these defectors from Kansas City and St. Louis and Tulsa, but Springfield is right there in the middle. So they kind of come down here, and it's an easy thing. I think they think they don't have to worry about their competition, so they can come here and kind of be on their own and join up with a couple other like-minded friends. And then the west side of, I mean, those kids that grew up on the west side of Springfield that are really tight and they don't rat on their friends, you know, the classic stuff you see, you know, kind of on TV and stuff like that. They grow up, it's just, I hate to say it's ingrained in them, but a lot of it, you know, I'll deal with a kid when he's 8 or 9 just at school or something in my neighborhood stuff, because I also do a lot of community events too, for good stuff, not dealing with drugs, but, and then, you know, you see them X amount of years later, and, you know, it's because their mom, whoever's raising them, is using drugs, and that's all they've been told they can do. That's the only thing they see, so when they see it, that's all they really learn how to do, instead of, Springfield's really trying with the schools, and I mean, they're really trying to combat this. It's just, it's what's going on right now. So that's kind of what I do, what I try to do. I go to the neighborhood meetings. One of our neighborhood people is over here now, and I try to get their concerns, and you know, we always try to protect the neighborhoods and try to let people know that it's okay to talk to us and point us in the right direction. You know, some people think that alone is snitching. Well, I think it's, don't you care about yourself and your neighbor, you know, that aren't involved in all this illegal activity, to better your grandchildren and your children. So, you know, hope we're trying to break down that whole, hey, don't talk to the police type thing. It happened a lot more in South Florida. I mean, we'd have shootings in South Florida, and no one would talk to you, and you knew they were out there. You knew they saw it, and they weren't going to tell you what went on. So.
I'm Crystal Brigman-Mahaney, and I'm Deputy Director for Missouri Healthcare for All, and we are a statewide grassroots advocacy organization. And especially prior to the election, so 2016, we had some pretty lofty, proactive goals we were going to work on, so we know there's a lot of gaps in our healthcare system. Then the election changed things, and so 2017 has been all about defense. And what I think is most important for me to use my time to talk about is defending access to Medicaid, because it is something that both a lot of our neighbors and a lot of our elected officials have a lot of misconceptions about what Medicaid is, what services it provides, and who is on Medicaid. And it's sort of like the biggest threat that we have right now on both the national level and the federal level. And we see Medicaid, like, one should be treated as a source of insurance, because that's what it is. And we know that the way that our system is set up right now, that in order to have access to quality health care, you mostly need coverage, you need insurance. And so in the state of Missouri, we have almost 1 million people who are on our Medicaid system, so 977,000. Low-income kids, pregnant women, people with disabilities, and older adults and adults. So it also, these funds help fund our safety net hospitals and nursing homes especially. I know a lot of you here in this room probably already know this, but especially in the state of Missouri, it is very, very difficult to qualify for Medicaid. So if you are like for instance, a single mom with 2 kids, so you're in a family of 3, you can't make more than $300 a month and still qualify for health services for yourself. And we know that whenever parents have access to quality, affordable health care, they're more likely to make that so their family is healthy and they're taking care of their kids, etc. Right now, Missouri is decent whenever it comes to coverage for kids through the the Medicaid system, and CHIP, which is the Children's Health Insurance Program. But these are under attack. And in Missouri, our Medicaid program covers 1 in 3 kids. I don't have the specific breakdown in Springfield, but since it looks like most of you are local, you know that especially that's going to be higher in parts of Springfield, especially northern Springfield. And obviously the effects of kids not having access to health care affects their ability to learn, and all of the issues we're going to talk about, we need to talk about in a holistic sense that if we care about our communities, if we care about having healthy families, we have to both like work on giving the services to those in need, but also figure out like why do we have these gaps to begin with, and what can we do to change this so year after year our different organizations aren't chasing after like grant funding to give a man fish versus teaching our elected officials that we should have access to fishing. So try to work on my metaphors here. And also in Missouri, 1 in 3 people with disabilities are covered by Medicaid. So whenever our elected officials talk about Medicaid is such a budget buster, which it's really not, it's one of the most effective forms of insurance, and it has great health outcomes, they're actually talking about cutting pregnant women off the program, cutting kids off the program, cutting people with disabilities off the program, cutting those who are on Medicare and nursing homes, make it so they can't have coverage for their nursing home care anymore. And 77% of those who access Medicaid are part of working families. So again, we're working to sort of dispel this narrative that there are Medicaid checks and you're living off the system and it's welfare. That is not the case. And I'm sure that most of us here in this room agree with our value that we should be increasing access to health care and coverage so we can have preventive care rather than cutting it. And so right now at the national and the state level, one of our biggest threats is that Medicaid program would be restructured or cutting that funding. And that comes in the form of a lot of fancy political words. You can call them block grants, call them per capita caps, per enrollee allotments, and all of these are fancy, like, sleight of hand versions of saying cutting Medicaid funding because we're looking at it as, oh, this is a big number and a lot of money. We need money for everything, so let's cut that, and ignoring the fact that you're cutting access for kids' health care, access to people who have chronic conditions or multiple disabilities so that they can lead anything towards a functional life. And also Medicaid and the Affordable Care Act right now provides a lot of mental health and preventive care. We know that in Missouri the average opioid death is higher than the national average. So if we cut Medicaid funding, we're cutting even more services and tools in our tool belt to be helping these communities and giving access to free mental health preventive screenings versus, waiting until it turns into a law enforcement situation and punishment and into our judicial system. So that's my 5 minutes.
Your time is very helpful. My name is Christine Temple. I work at Ozarks Food Harvest. So we are the only food bank serving Southwest Missouri. We serve 28 counties in the area, and we provide food through a network of after-school programs, summer sites, senior centers, and traditional food pantries. So Ozarks Food Harvest is currently providing 15 million meals every year to the Ozarks, and we're serving actually 1 in 4 people in the Ozarks access food assistance through one of our programs. So hunger is very related to poverty, and so we know that a lot of people in our community are really struggling with just meeting their very basic needs. And we feel that food access is a right for all people, and we believe that there are certain circumstances that happen in people's lives where it makes it difficult to provide food for their family, but we kind of are there to fill in the gap. We do rely on government funding. About 20% of our programs are through government reimbursements. Specifically, that's our after-school and summer feeding programs for kids. And then we do receive some community development block grants to fund our child feeding programs. The hunger rate in Missouri has really gone up since the Great Recession. That's where we really saw the biggest hit happening to Southwest Missouri. We obviously serve Greene County, and so that's a more metropolitan area, but we do also serve those rural areas that are relying on certain factory jobs. And if those close or if there are layoffs, people, if they own their home, they can't necessarily find a better job. So we just are trying to provide that food for them with also some dignity. Somebody mentioned this to me earlier about how dignity is so important. It's very difficult to make the choice to go to a food pantry or to put your child on a feeding program, and we feel that it's very important to make sure that that person knows that we're not judging them, and we're trying to educate the community that they should not be judged for what's happening in their lives. 85% of people we serve are living with a household income under $20,000 a year, and that's typically multiple people in a family. And if you can even try to imagine paying for your bills and just the basic necessities with that, if we can help with food, then that person can pay for medical care, or they can pay their rent, or they can pay for gas to get to work. So we feel that food is kind of that, lowest, on the totem pole, that, Maslow's hierarchy of needs, if you kind of remember that. If you don't have food and shelter, you can't succeed and you can't get better in life. Also for kids specifically, we feel that it's extremely important to make sure that kids are being fed. 1 in 4 kids in Southwest Missouri are what we call food insecure. So that means that they're not sure where their next meal is coming from. They may eat, but it's not that guarantee when you go home that mom and dad have dinner on the table. Maybe you do have to go to a shelter or a pantry to get your meals. And that just affects kids in a lot of ways. If you think about trying to learn when you are on an empty stomach, and trying to develop socially, there's that stigma attached to hunger. So we're trying to really fill that gap for kids. And another program that we feel is really important is the SNAP program, which was formerly food stamps. So we have 2 staff members at Ozarks Food Harvest who do SNAP outreach. Last fiscal year, we were able to help provide 630,000 SNAP meals to Southwest Missouri. And this program is extremely important to do outreach because every year Greene County is actually laying on the table $20 million worth of SNAP benefits that are going unclaimed because people aren't aware that they're eligible for SNAP, or there's that stigma attached to it and they don't want to use an EBT card when they go to the grocery store or the farmer's market or wherever those are accepted. So we're trying to get rid of that stigma at Ozarks Food Harvest. And we really use the phrase a lot that these are our neighbors that we're feeding. If it's 1 in 4 people in Southwest Missouri, it's probably somebody that lives in your community, and it's probably somebody that goes to school with your kids. And so if we think about it that way, it really removes that stigma, and it allows us to get more donations as people understand what we're trying to accomplish with our goals at Ozarks Food Harvest.
So I'm Krista Moncado, and I am the Executive Director for the GLOW Center. The GLOW Center is Southwest Missouri's LGBT community center, and we are celebrating 21 years this year, so we've been around for quite a while. But even though we've been here for over 20 years, a lot of people don't know that we're here or don't know what we do. So what we do is we provide support, social support for the LGBT community, and we also provide education and awareness to the general, broader community. Last year we logged over 2,000 volunteer hours. We served over 1,100 meals to area LGBTQ youth at our youth program that meets on Tuesday evenings. And we have over 3,000 people attend Greater Ozarks Pride Fest that happens on Park Central Square every June. This year it's June 17th. I know that Greene County Dems are always there, and we hope, and a lot of people here at the table. So we hope that you're here again on June 17th. So again, what we do is we provide that education and awareness to the broader community. A lot of people think unless they know or have somebody that they know and love that is gay or transgender, they don't really think that there are gay and transgender people here in the Ozarks. And that's really what we're combating, is simply the fact that there are queer people here. And then to access any of the help that's here today, whether it's Ozarks Food Harvest or healthcare or talking to the police, there's that additional stigma of, well, I'm not out to my parents, or I don't know how they will react if they know that I'm living here with my same-sex partner, or I'm transgender and I present and look one way, but on my driver's license It says a different name, I look differently, and my gender marker doesn't match who I am. So there's all these compounding issues that come to simply accessing appropriate resources and being able to keep your job, keep your housing. In Missouri, it is currently legal to discriminate somebody in employment, housing, and public accommodations. So that includes something we talk about a whole lot, unfortunately, our bathroom bills. And we know that when a person, whether it's a student or an adult, is allowed to exercise their right to use the bathroom that matches their gender, that everyone is safer. When we make sure that the most vulnerable in our community, no matter whether they're LGBT or they need access to healthcare or living in poverty, when we take care of the most vulnerable of our population, everyone's lives are better. When we take care of LGBT people, when we make sure that our transgender students are able to use the bathroom that matches their gender identity, everyone benefits, everyone's safer, everyone's privacy is more protected. And that's really what we try and do with providing that education and awareness of the LGBT community in the Ozarks, is because nobody wants to talk about it. Nobody wants to ask those awkward questions. And I'm all about the awkward. I'm always awkward all the time, so bring on your awkward questions. We provided training for over 500 professionals in agencies and organizations in Southwest Missouri last year alone. So if that's something that your organization or your company wants help with, to figure out how can we support our employees that are transitioning and aren't sure how to come out. How do we talk to our children about if they identify as LGBT? How do we make sure that our employees are providing appropriate customer service to the LGBT community? We can help you with all of those things. Because again, as we know, the more that people are free and to live their lives with dignity and respect, our entire community is better. And I give my extra time to Jack. About 30 seconds, that's it.
I'm Jack Embry. I'm chairman of the Homeless Veterans Task Force here in Springfield and Greene County. A lot of you probably never heard of it. We were formed in '09, that's 2009. And the reason we were formed is the city of Springfield was offered what were called HUD-VASH vouchers. And that was HUD, and you know what HUD stands for. And there was a special program coordination between HUD and the Veterans Administration. City of Springfield turned them down. Now, we fought every year since then, and in 2014, think about that, we finally got HUD support and HUD vouchers. Now, which means that now, by the way, when we turned down our HUD vouchers in '09, Joplin grabbed them and took them. Joplin right now has, I think, 100 and some vouchers. We're lucky, well, we now have 19 in Springfield. So every year vouchers came out, except Springfield, of course, we didn't get it. Now, we're also a part of the broader continuum of care, which also has a different name now that I can never remember. But that's all the agencies in the 14 counties in Southwest are part of the continuum of care. All of these people you heard here are involved. I'll speak now just for the homeless vets. Without, I think, maybe a few exceptions, almost every case we get of a homeless veteran, we're involved with almost every one of these agencies. We need their support. The thing that we're concerned about right now for homeless people as well, but specifically for homeless veterans, and I want to read you a little thing here. Shutting the agency and cutting funds for low-income housing remind expert of Reagan's deep spending cuts that ushered in a new age of homelessness. Those of you are here that are old enough to remember when Ronald Reagan cut all the funding for homeless and folks that should have been in institutions were closed. Those folks were all on the street. And we've had this serious homeless problem since then. And we're still dealing with it today. We're making progress, particularly with homeless vets. We've done very well. And at one point in time, we reached what was called functional zero. Now, you reach functional zero by mathematics. But then somebody decided, well, that's not going to cut it. We got to find out how many homeless vets we still got out there. So every year we count as best we can the homeless vets. So we're still not at zero, but we're making a deep cut in it for the broader homeless population. For a period of time, it looked like we were really making progress. And then, in the last 2 years, we have seen, to me, a significant increase in the number of African American homeless couples. Now, I don't know what caused that. We still don't know. We gather all the data. Missouri State's got a program where they analyze all the statistics. But that was troublesome. It's still troublesome. And I would like to say that any of you that have money to offer, if you want to donate it, or clothing that you want to donate, you can bring clothing to Democratic headquarters, and I will get it to the proper place. And if we're collecting food, that's going to go to what used to be Bill's place. Kitchen is a big supporter, and that's probably, that's good. I did, well, no, we need to leave time for questions. Well, that basically is a broad picture of homelessness in Southwest Missouri.
Does anyone have any questions for the panelists? Yes, ma'am.
What is the primary drug that is creating most of the problems?
It's still meth. Heroin is on a really big rise. We are seeing a lot of it, quite a bit of it come in. And it's partly due to the prescription pill, opioid stuff. Especially when I worked in South Florida, I had so many kids that I dealt with. When I say kids, I still think 20, I'm not that old, but yeah. In the early 20s, late teens that, got in a car accident, got prescribed 180 oxycodones, thought they were to get them better. Well, they didn't know that. They weren't educated prior to taking those medications, and then they become addicted. And yes, there are other factors in our life too, but it's definitely not still in Springfield. And I'm seeing a lot less labs, a lot more coming from Texas and other areas, a lot more real.
I have a piggyback question. But that it used to be a situation where a lot of kids were prescribed medicines for ADHD, which in turn they were never given, but their parents were selling on the street. I think at one time I had heard that Adderall was going for $12 a tab. So you had someone using the Medicaid system to supplement their income by selling it. Are you seeing any of that?
Me personally, no. Maybe our MSU guys that are contracted to work at MSU, the college, Adderall and those kind of things are definitely used as like a study drug and other party type drugs. I don't see that as much. I see meth, heroin, and sometimes some pills. Not too many pills I deal with either, but mostly about heroin.
Mike Salon, I have a question for Chrissy. On Medicaid in Missouri, as I understand, because it hasn't expanded, that they're closing a lot of the small rural hospitals, so people have to be transported to major centers like Springfield or wherever to get addressed. Has our state senators and congressmen, have they even been addressed on this, or they care, or what? What's your opinion?
So most of the session up to this point has been focusing on stopping this Senate Bill 28 on the state level, which in their very walky terms would seek a global waiver to block grant Medicaid. Thanks to all of the grassroots pressure that has now been stalled and it's on the informal calendar, and because of the grassroots pressure, we had heard that Senate Bill 28 was the bill that that all senators had gotten the most constituent contact out of any other bill happening in the Senate. We are working on taking that momentum and that message to pivot to be talking about Medicaid expansion or a Missouri solution of like, okay, like, especially if the federal government were to block grant Medicaid, which we're going to fight tooth and nail against. You've seen other states that are being led by Republicans who are more likely considering Medicaid expansion because, again, to be very wonky, a Medicaid block grant would be based on your historical spending or historic federal funding that you get for the Medicaid program. So if we were to expand Medicaid, it would obviously be very good in many reasons, but would also maybe help pivot and move some of our traditional opponents to consider a Missouri solution of expanding Medicaid because it would protect the amount of federal funding that we have. So unfortunately, the first part of the session had been mostly defense, and now we're starting to pivot much more severely or intentionally to be talking more about Medicaid expansion. Like, okay, we don't know what's going to happen on the federal level. Let's come up with a Missouri solution so we can cover more people in whatever ways that you want to call it. Hopefully we'll get progress on that this session, and if not, it'll still put us in a better situation for 2018.
Thank you.
Can I ask Crystal a question before she moves on? What have you heard on the availability of federal funding? The reason I ask that is because we're dependent on a lot of HUD funding as well as VA funding. We're not worried about VA, but we're worried about HUD. What have you heard?
Don't know. Sorry, I don't have the
The
answers to that.
everything we've heard is not good.
Right. Yeah, it is. I mean, we'll see what happens at the end of this month with the federal budget in general to see if we're going to have a federal shutdown of the government and to see what's going to happen.
I had actually heard that HUD was one of the things, but
Oh yeah, well that's worrisome.
yeah.
Yeah.
Well, I mean, at the top of the list, the NEA and HUD were on so I don't know.
Would you address the effort in the state legislature to make it much more difficult to sue for discrimination?
The religious referendum bill? Is
that the one? Yeah. Where?
Well, there's a couple of them that have, well, I think,
Take your pick.
yeah, there's several. The most common, and whether it's at the state level or at the federal level, is what they're calling either the First Amendment Support Act, or it's the or religious referendum bill. So what that says is, the basic idea is that you are able to, anybody can discriminate against anyone based on on your own religious beliefs. So the problem is, one, that religious freedoms are already protected, your religious rights are, but as we know, and as we've been taught in history class in elementary school, which some people evidently have forgotten, but I'm not bitter, is that my freedoms end once your freedoms begin, right? So that there can be, I'm not infringing upon yours and you're not infringing upon my rights. So that is already set in non-discrimination clauses across the country, at the state level, the city levels, the county levels, all the way up to the federal levels. But they don't say anything about gay in it. So they don't say anything about transgender people in it. And so in some cities, in some areas, that's been used to strip all the non-discrimination categories out of language. So for example, in Houston, when Houston lost their non-discrimination protections, it wasn't just for sexual orientation and gender identity. It was a whole host of categories, including religion, race, creed, political stance, like all of those things. So they're actually causing more damage than what it was intended. Again, what that means is that even though it already is legal to discriminate against LGBT people or against anyone regarding sexual orientation or gender identity, they're adding those protections so that even if there is discrimination and it's already legal, that even if you wanted to change that by filing a lawsuit, that you would not be able to file a lawsuit on that. So again, it's increasing more of that bipolarness.
Okay, we're going to take one more question, and I just want to remind everyone that the panel is going to be available on the Greene County Democrats website, on our Facebook page, and when you meet someone who wants to be a volunteer for the Greene County Democrats or for any Democrat organization, to please send them to watch this video so that they are up to date on our talking points and that they remember what issues are facing Southwest Missouri, and they know the statistics, and we are all on the same page. Okay, so Virgil, you had a question?